Hi, I'm Amy Schell. I'm a physician in the Department of Otolaryngology at the University of Colorado. In short, I actually grew up around it. So my dad was a doctor, my mom used to be a nurse, and so medicine was always part of my life growing up. My dad is actually also an ENT physician. So as any teenager, I obviously wanted to do something completely different when I hit college, and I actually started by studying engineering because I was always really interested in the practical application of the science that I was learning. By the end of those 4 years, I realized that that practical application for me and my passions was in that direct interface with patients. And so I ultimately decided to go to medical school and be a doctor. I'm an otolaryngologist or an ear, nose, and throat doctor. And so I specialize in the treatment of disorders of the ear, nose, and throat. I actually subspecialize in the treatment of sleep apnea, which is kind of how our upper airway in our throat interfaces with the way that we breathe at night. I really feel that in treating patients, there has to be a partnership between the physician and the patient. And so the first thing that I strive to do is give the patient the knowledge that they need to move forward with that partnership. So for them to make educated decisions about how they want to go about their care, they first need to know what they're dealing with and why they need to treat what they have. And so I really value my ability to educate my patients first and foremost. I very much value that interaction when I'm able to go through a patient's, even just their test results, and explain to them what's going on and just see that moment, perhaps when a light bulb goes off and they realize, oh, this is what's been going on. This is why my quality of life has been affected. And then being able to kind of take them through that journey to improve that quality of life is so meaningful. And being able to follow them through that is really what gets us through the day as doctors.